We have recommended the penile implant because this is the best option for you as an individual patient. Either the other options haven't worked or have side effects that are not tolerable, or they're not spontaneous enough for you. And then we know that this will work, and the satisfaction rates are extremely high. The penile implant surgery is an extremely quick day surgery. The procedure takes less than 30 minutes to do from start to finish. During the procedure, we make a small 4-centimeter incision right at the base of the penis, between the penis and the scrotum. This incision is where we implant all 3 devices through this one small incision. One great thing about this procedure is that because it is so minimally invasive, there's no need to stay in the hospital after the surgery. You're able to go home the same day and rest in your own bed where the best recovery takes place. The clearances prior to surgery will vary depending on the patient. We will look at the whole picture and see exactly what other medical conditions are involved, and we will tell you if you need any clearances from other physicians, such as cardiologists or your primary care doctor, or if you're on blood thinners, when to stop them. You do need to arrange for transportation after your surgery. You will not be able to drive yourself home. If privacy is a concern, you could tell people that you're undergoing a hernia surgery or any other groin surgery. We have lots of patients that do this for privacy concerns. Prior to surgery, we want all of our patients to use the vacuum erectile device. This ensures that we are able to provide you with the best possible length and the biggest size device that we can possibly give you. Otherwise, we start an antibiotic the day before surgery. So that's just a pill you take the morning before surgery, and then you continue after surgery. And we do want you to do a Hibiclens wash in the shower for 3 nights before your surgery. That's a simple soap that you can find at any pharmacy. It's an antibacterial soap, and we just want you to wash, and especially wash the genital area, for 3 nights before your surgery. That will ensure the least possible infection rates. Myself and the anesthesia team will carefully look through all of your medications to determine exactly what needs to be continued and what needs to be stopped prior to surgery. The main medication that we would usually stop prior to surgery would be blood thinners. So if you are on any blood thinners, please let your physician know, and we will tell you when to stop them prior to surgery. Please do not eat or drink anything after midnight the night before your surgery. You do want to stay hydrated the day before, but once midnight hits, do not eat or drink anything else. Otherwise, there is a risk that the surgery will be canceled. On the day of your surgery, you really just need to bring yourself, you need to bring somebody to drive you home, and then just bring loose fitting clothes. You're not going to wear some tight pants after surgery, so if you're wearing jeans, please bring loose pajama pants or loose basketball shorts that you're going to feel comfortable wearing home. Do not shave prior to surgery. Once you're asleep under anesthesia, we will shave the parts that are necessary to be shaved for the surgery. On the day of surgery, you will come to the surgery center or the hospital, wherever we are doing the procedure. You will check in at the reception desk. They will bring you back into the pre-operative area. There you'll get a chance to talk to myself, and I can answer any questions that you might have come up with within the last 24 hours. You'll talk to anesthesia, who will go over their entire plan of how they're going to do anesthesia and how they're going to put you to sleep. They'll talk about any risks involved with that as well at that time. We will also start some IV antibiotics. That's the best way that we can help to prevent infection. After this, you'll go into the operating room where you'll be put to sleep. Once you're asleep, we do the procedure. The procedure takes roughly 30 minutes to do from start to finish. Afterwards, anesthesia will be reversed. You will wake up. You will still be groggy. They will take you to the anesthesia recovery unit. You may be there for an hour or two before you are completely awake and ready to go home. The best advice that I can give on handling nervousness prior to the procedure is to know that you are under the care of experienced hands. You're under the care of somebody who has done many penile implant surgeries in the past, and that in 6 weeks, you're going to be extremely happy that you had this procedure done. If you have any questions before or after your penile implant surgery, please do not hesitate to call my office. They will get in contact with me if there's any questions that they can't answer, and I will reach out to you and answer your questions to the best of my ability.